evaluation. How we can clinically evaluate the patient with the multiple myeloma? First, physical examination. Any disease, first step after the history, it is a physical examination. Physical examination, tendon bone and masses, enlargement of spleen and lymph nodes, the physiological site of antibody production. This is in minority of cases. Exudate macular detachment, that is very important. Macular, this is exudate macular, retinal hemorrhage or cotton wool spot. Amyloid deposition on the tongue causes macroglossia. It is minority of the patient. Cardiomegaly related to the deposition of immunoglobulin. Positive tenile sign, this is a very important sign, but it is in minority of patients can be present with the carpal tunnel syndrome due to the amyloid deposition. Now, blood studies. The first blood studies, it is CBC. CBC can find patient anemic or pancytopenia, ESR elevated, calcium, as I said, is hypercalcemia. If it is hypercalcemia and patient presented with the renal failure, actually blood urea and serum creatinine can be elevated. Serum alkaline phosphatase is currently normal. Absence osteoblast, that is mean absence of osteoblastic activity and hypoalbuminemia. This is just picture of the blood film, peripheral blood film. This is the plasma cell. This is plasma cell, and form what is called Rolex formation. This is Rolex formation. What is the Rolex formation? Rolex formation, red blood cell, one attached with the other, attached with the other, attached with the other, and called what is called Rolex formation. This is multi RBC form, but it is not spot diagnosis for the multiple myeloma. Can happen in other disease. Now, imaging, what is can do for the patient? We can do chest X-ray and bone for radiological, and this is can give the first idea about lytic lesion or diffuse osteopenia. Also, we can go more invasive with this MRI. MRI produce what is called myeloma tumors. Do document cord, it's very important, or rod compression. This dangerous one, need urgent treatment in patient with a symptom to assess efficacy therapy. By radiological improvement occur about 30% in treated patient. This is a film of the bone marrow. When the bone marrow aspirated from the posterior iliac crest, this is the plasma cell. Bone marrow demonstrated this is a plasma cell. The form of a plasma cell in the bone marrow differ from that in the blood film. Okay. This is another one. This is biopsy. When you go to take the bone, aspirate, also take the biopsy from the bone. I mean bone marrow biopsy, not bone itself. Another form of the diagnosis we use, which is called evaluation of the protein. As I said, first slides called electrophoresis. And electrophoresis either use what is called monoclonal gammopathy and myeloma. For single clonal of a plasma cell produce a homogeneous monoclonal immunoglobulin. I mean, so this is albumin and multiple myeloma, as I said here. The wave or the AMO protein, narrow peak, spike in the G, beta or alpha 2 region. And this is one way for diagnosis for the multiple myeloma. You can say to patient and write serum protein electrophoresis. It is present in many hospitals in Iraq. This is as the form, as I said, alpha 2, 1, 2, beta, and gamma. Okay, also we can use fish. This is cytogenic. This is way of the fish. It is present in some high centers in Iraq. And the fish can give also can divide the patient with the high risk, intermediate risk, and standard risk. Now, what are